Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Today we are reporting 13 new cases of COVID, 7 in Central and 6 in the Eastern Zone, mainly in Sydney. Our two other zones, Northern and Western, are reporting 0 cases today. Of course, those numbers will fluctuate, but it is amazing to see how hard work is helping to reduce our case numbers and contain the virus. I'm grateful to everyone for continuing to follow the protocols and restrictions in place. I know it isn't easy and everyone is getting tired, but we are in a very good position. Dr. Strang and I voiced some concerns earlier this week about the testing levels. Not enough of you were getting tested, particularly in Halifax, our largest centre, where we've still seen some few of our cases coming in with unknown sources of contact. So we want to make sure that we're continuing to promote testing, and I'm happy to hear that our numbers are back up. We ran over 4,000 tests yesterday. We've also made testing available for domestic arrivals at the Halifax airport, the only jurisdiction in Canada to do so. And we're doing that to get out in front of our reopening. This is one piece of our comprehensive strategy to contain potential spread. In Nova Scotia, we need to continue what is recognized throughout Canada as a leading approach with testing, to continue throughout all the phases so we can move through each phase on target, the next one scheduled for June 16th, 1 week from today. We know when the Delta variant is on offense that testing is our best defense, along with our public health restrictions. So thank you for making testing part of your routine. So let's start phase 2 on time next week. The vaccine is starting to ramp up more, and we're surpassing our targets with our rollout. And today's a big day. We're expecting to administer over 17 doses of vaccine. Still providing first doses to some Nova Scotians, and that's starting to end soon. We are weeks ahead of schedule with the second doses, and I want to thank all of you for continuing to book your appointments. We're now at 62% of all Nova Scotians, of the whole population, with 1 dose of vaccine. And don't forget, please, just because you have 1 dose of vaccine, to continue to get tested throughout this time as we start to open up. And I'll turn it over to Dr. Strang.
Thanks, Dr. Strang. Dr. Strang, thanks, Premier. And I believe you meant to say, I believe you meant to say 17,000 doses, not 17 doses of vaccine.
17,000 doses, yes.
We're off to a good start. And good afternoon, everybody. Our new cases, our new daily case numbers are holding steady in the teens, and we are able to connect most of those to travel or previously known cases. But we still have some cases in the Halifax area that we cannot connect to a known source of infection, which tells me that there is likely some low level of community spread in the Halifax area. And that's why testing is so important, not just in Halifax, but across the province, because unless we test, we don't know for sure that the virus isn't somewhere else. We want to know about every case so that we can stop the virus from spreading. So whether you have one symptom, even mild or no symptoms at all, book a test or drop into a pop-up site. And as the Premier said, build regular testing as part of your routine. The more you're out, if you're going back to work, you're back at school, you're opening up to more social activities, the more people you are in contact with in your regular life, the more frequent your testing should be. And let me update you on a few things related to our vaccine rollout. As the end of day yesterday, 62% of the Nova Scotia population is now vaccinated with 1 or more doses. If you look at numbers, provinces use different metrics for their vaccine programs. But nationally, the Public Health Agency of Canada tracks the percentage of the total population who have received 1 or both doses, and that's what Nova Scotia does. And we are in line with the rest of the country, and all provinces should be reaching their 75%, minimum 75% of the entire population with having 2 doses of vaccine at about the same time, toward the end of the summer or early fall. Meeting this target will give us the best population protection. 1 dose is only halfway there. We are very close to reaching our 75% threshold for the first doses, and we will get there more quickly for second doses now that we have the supply and the ability to move the scheduling of second dose appointments up considerably, a number of weeks for people. And I've heard some cases where people were able to move their second dose appointment up by 4 weeks. So we're really on target for that 75% threshold by the end of August. By tomorrow, we will have sent about 75,000 invitations asking Nova Scotians to book their second dose sooner. And people have that's going to be done by email. If people don't have an email, they can certainly phone the vaccine line, which is on our coronavirus website, and provide an email. Email is the most important way. And if you don't have an email at all, then you can do things by phone. We'll continue to send out these invitations for people to move their second dose appointments up. The timing of that, when you'll actually get your email, will depend on our vaccine supply. But with today's news that Canada is expecting a large Moderna shipment this month, we could have even more flexibility. We don't have the details on amounts and dates of delivery, but we are expecting to get a significant amount of Moderna, and we are prepared to deliver that extra amount of vaccine in a very timely manner. And that's all good news. It just allows us to be even faster than we expect. And simply because all our planning and our projections have been based on the Pfizer supply. So getting more vaccine means that we'll get to our 75% of two-dose target even faster than we had projected. And I have to encourage everyone if you haven't had your first dose, get your first dose. We're making very good progress there. And everybody needs to do the next part, which is get your second dose as soon as you're able to book that appointment. Every person vaccinated gets us closer to our new normal of living with long-term with COVID, but it's especially even in this interim period through the summer that we need everybody as soon as they can to get the two-dose protection to protect ourselves from the Delta variant. And that is projected to becoming the dominant strain in some provinces, if not across the country. And we know that the literature shows that against the Delta variant, a single dose of vaccine is only about 30 to 40% effective against protecting against illness. And so, but two doses are very good protection. So the two doses is, I can't say it enough. It's critically important that we build a two-dose coverage for as many Nova Scotians as possible. As we've talked previously about our vaccine uptake rates, Nova Scotians over 60 have set a very high bar. Our coverage rates are very good and are continuing to climb. But as we near the finish line for our first dose program, we will look to identify areas or groups where the uptake is not as high as we'd like, and then we'll work at a very local level with public health and community partners to increase those numbers in specific groups and locations. We will look at whether certain age groups, communities, or specific groups may be identified and need a more targeted approach. But in the meantime, if you haven't gotten your first dose, please book it and book for your second dose. And if you know family members, friends, neighbors, or co-workers who haven't yet got vaccinated, encourage them to book an appointment or to talk to their family doctor or a pharmacist about any questions they may have about vaccines. And before I wrap up, I want to mention some work that is happening to encourage vaccination in specific communities and groups. Not everyone is comfortable or able to go to a community clinic or a pharmacy to get their vaccine, and that's why we have developed a number of different options to help ensure all Nova Scotians have access to their vaccine. We brought vaccine to homeless shelters and to day programs for Nova Scotians who have disabilities. We've worked with community partners to hold clinics in First Nations and African Nova Scotians communities. And we're taking the vaccine out on the road with our public health mobile units. And we now have a drive-through clinic to make it easier for those with mobility or sensory issues. We have several of those in the province. And there's a couple of specific items I just want to end up highlighting. On June the 19th, the Umma Mosque and Community Centre will host a vaccine clinic in partnership with the Rockingham Guardian Pharmacy and Public Health. That's a great example of how we can build partnerships with specific parts of our community with specific needs to access vaccine in unique ways. And while the goal is to make members of the Islamic community feel comfortable, they are welcoming anyone who wants to book an appointment at this clinic. So people can book by calling the toll-free line, and they can ask for an interpreter and get services in more than 125 languages. And I also want to update people on the in-home vaccination program. We know some people can't get to a community vaccination clinic due to mobility challenges or health issues that prevent them from leaving their home. And a couple of weeks ago, the program started vaccinating people in their homes who are receiving continuing care services through Nova Scotia Health. And as of today, 302 people have been vaccinated in their homes and 70 more are booked. And we're nearly ready to expand this program to others who need a first dose and can't leave their home. And more details will come very soon to let those individuals know how to access the program. I'm very proud, and I believe the Premier is too, of the work being done to ensure all Nova Scotians can access the vaccine and have the information and support they need to feel comfortable. The vaccine team is doing amazing work, and the support from health and community partners has been nothing short of inspiring. So please, get your vaccine first and second doses. And if you haven't booked yet, that's okay. There are appointments all over the province, and it's never too late. The vaccine is our way out of this pandemic and the best way to protect ourselves, our loved ones, and our communities. Chrissy.
We'll now go to one question, one follow-up in the time that we have for today. We'll begin with Natasha Pace with CTV.
Thank you. Premier, given that Nova Scotia has already surpassed 60% of the province's population with at least one dose of vaccine, are you considering potentially moving into phase 2 before next Wednesday?
No, what I've said all along is that we need to make sure that we're basing our response to this pandemic on the advice of public health and the science and epidemiology. The vaccine is just one part of our indicators as we move to the next phases, but I think we were clear that the 2-week time frame was needed, especially opening up with the first phase. So the second phase, we believe, is on target for that June 16th. The 60% being hit early is a positive thing, and we're approaching 65%, and we're having discussions about what it looks like for phase 3 and 4. But at this point, I don't know if Dr. Strang wants to add to this, but we're comfortable, but we need to stay cautious for next week for phase 2.
I'll just add, I think it's about 2 weeks. I mean, the federal government says the Public Health Agency of Canada all along has said provinces should base things at least on 3 weeks. We've chosen 2 weeks because we believe the progress in our vaccine allows us to be that aggressive. But we need that minimum of 2 weeks, especially in these early first phases as we start to open up. And also, it gives us time to make sure that our vaccine program is rolling out well.
Go ahead with your follow-up, Natasha.
Thank you. Dr. Strang, we're hearing that some Nova Scotians have been having trouble booking their second appointment for their second dose of vaccine. Is this something you're aware of? And if so, what's being done to fix this?
So the vast majority of people we keep hearing, are having a very good experience with booking whether it's online or with a phone. There may be the odd person that has some challenges, and we're dealing with those as we made aware of the vaccine program team.
Next, we'll go to Jean Laroche with CBC.
You think I could learn? I would have learned by now to unmute. Sorry about that. Dr. Strang, just to follow up on my colleague's point, and my question is specific to people who are here from other parts of Canada who have had one shot and need their second, so they got it elsewhere, their first shot elsewhere. These are people who have traveled here before the border restrictions were tightened, and some of those people are telling us that they are having no luck booking their second shots because they don't have an MSI card. They have been told to email your exceptions committee, but have received no satisfaction there. What is the province doing or planning to do for these people, some nearing the limit of their interval of 105 days?
So there's nothing magic about 105 days. These people will get slotted in along with other people who are here in the province as we roll out our access to second dose. They may be a little bit beyond their 105 days. That doesn't create any risk at all in terms of them getting an excellent response to their second dose of vaccine, or certainly all the evidence they'll still have good immunity from their first dose. So we're not going to make them a priority ahead of anybody else, but they'll be able to be moved in as we roll out the second dose vaccine for everybody here in the province.
Go ahead with your follow-up, Sean.
So you're not making them a priority, but are they at the back of the bus?
No, they'll be able to, as everybody else is able to, as I said, through the exceptions team. We have a process that people who are immunized by one dose somewhere else can then get in and can get in the line with everybody else and get their second dose. The couple of the cases that I'm aware of that people aren't happy that the answer is that they're not going to get their dose if they'd stayed in Ontario, for instance, and gotten there where they would have been scheduled for their second dose in Ontario. We're going to put them in line with everybody else. We're not creating any risk to their health by doing that.
Next, we'll go to Keith Doucette with the Canadian Press.
Good afternoon, Dr. Strang. I'm wondering about, based on this news of more vaccines coming, might you change the age approach to, say, even accelerate it further? In other words, you're going in 5-year increments right now. Could you reach a point where you go to, say, 10 or even 15-year increments at some point, given the fact that the Delta variant is looming out there?
So we're just being made. I'm assuming you're referring to the announcement today by the federal government on the increased Moderna vaccine supply. We had no pre-notice on that. We learned that as the feds announced it. We still have no details on exact amounts and timing. Right now, we're glad to hear this. We have more capacity to administer vaccine than we actually have vaccine. So we'll just add that extra vaccine, whether that's enough to allow us to adjust and do more than 5-year age cohorts. I'll leave that to the vaccine program folks to work out those details once we get the specifics on the amount and timing of the Moderna supply.
Go ahead with your follow-up, Keith.
Yes, and for the Premier, I'm wondering about moving up the phases of the reopening plan, off the back of some of my colleagues' questions. Are you saying today that it's going to be a 2 weeks at very minimum for each phase, or with no adjustment, or could, based on the factors you've listed in the plan, could it be accelerated? I know there are certain business elements out there that they're saying, well, we may not have exact dates, but we feel that perhaps they could even accelerate the plan more if they see the signs improving. What exactly? I wonder if you could just clarify where you are in terms of the 2 to 4 weeks.
Yeah, so I'll reiterate what Dr. Strang said, especially at the beginning. It's important as we look to open up. We're in phase 1. We both felt that we needed the 2 weeks to get to phase 2. But things change all the time with our vaccine uptake and our other indicators, and we could be in a very different position when we get to mid-June to look at the elements that are in phase 3 and phase 4. So there's ongoing discussions about those that have 2 doses of vaccine, for example. So we've made the accommodation for rotational workers and allowing them to come in with an exemption on the isolation period. So those discussions are always ongoing. I think we've been fair all along, but I think that we're comfortable where we are today with the 2-week intervals. And I know that business wants certainty. We've set target approaches on the 2-week periods. I think folks can be comfortable to book trips in Atlantic Canada for June 30th and the rest of Canada for July 14th. But we continue to look at that and how we could provide more accommodations for those that are especially vaccinated because they have more protection.
Next, we'll go to Elizabeth McSheffrey with Global.
Hi there. My question is for the Premier, I guess. Ottawa is set to announce today that fully vaccinated Canadians won't need to do a full 2-week quarantine, and they'd also be eliminating the 3-day authorized hotel quarantine system for those travelers as well. I'm wondering if that affects or concerns Nova Scotia in any way, and if Nova Scotians who are returning from international travel but have been released from the federal quarantine requirements, will they have to do another quarantine if they are entering Nova Scotia?
So that's part of our active discussions. I saw that news the same time as everyone else today on the exemption, and so that's what we're looking at so that we continuously be fair, and we know that 2 doses of vaccine provides a lot of protection for people. So this is something that we hope to be able to accommodate in our plans as we know more.
Go ahead with your follow-up, Elizabeth.
Thanks. And I just wonder what you think of Manitoba's plan to use a lottery as incentive for folks to get vaccinated. Is there any chance Nova Scotians could win some big bucks here for getting 2 doses?
Well, what we've seen in Nova Scotia is a significant interest in getting vaccinated. We have uptakes in the 80s, some categories over 90%. So we're hitting our targets. We're ahead of our schedule, and even in the younger cohorts where there was some concern at the early stages that we may not get that type of interest, we're seeing Nova Scotians get out and get vaccinated. So we're not seeing the need. We just need more supply, and we'll be able to continue to vaccinate. But I don't see a need to incentivize folks right now.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Thank you. Hi, Premier. I'm wondering if you could give me, if we could get a reaction to the letter that was signed by more than 80 Nova Scotia businesses calling for a reopening plan that better aligns with Newfoundland and New Brunswick.
Well, we've always had the opportunity to have dialogue over the last number of weeks especially. We've engaged businesses of all sectors, especially those that are impacted the most by our shutdown. New Brunswick and Newfoundland weren't shut down for the month of May. Their third wave simply wasn't at the same time. We're just finishing that third wave, so I think it's obvious that our reopening plan will look a little bit different, and we're in different stages. But we continue to try to align as much as we possibly can. We're listening to concerns being raised, and I think we're being fair with some 2-week interval target dates, and we'll continue to listen to businesses that have concerns with our plan.
Go ahead with your follow-up, Lindsay.
Thank you for that. Dr. Strang, I understand that the news of the 7 million Moderna doses is brand new and that there's no confirmed numbers yet. I'm wondering if you can provide sort of an estimate on just how much, though, this could speed up a vaccine rollout. You said earlier that our capacity to administer is much greater than our supply. I'm wondering if you can help us understand how much this increase might speed up our vaccine rollout.
So until we get exact details and confirmation of amounts coming to Nova Scotia and the timing of those amounts, it's really hard to make any adjustments to our program, and so we'll do that. As we've done all along, we don't make plans until we have absolute confirmation of the vaccine, and then we're able to quickly roll that into our existing program. But we won't know the impact. It's all positive. We know that. The more vaccine we have, the faster we can vaccinate Nova Scotians. But exactly how much and how much faster, we'll wait to get the details.
Next, we'll go to Adrian Blanc with Radio Canada.
Thank you. Dr. Strang, several organizations point out that based on the NACI recommendations, after healthcare workers, temporary foreign workers should have been next in line to get their first shot of vaccine. However, we were told that most of the temporary foreign workers were not able to book a vaccine or go to their appointments. So my question is, were temporary foreign workers prioritized in the early stages of the vaccination campaign in Nova Scotia?
Yes, they were. We made specific efforts to work with our agriculture colleagues and the specific farms with temporary foreign workers to make arrangements to have those individuals get access through one of a community clinic or a pharmacy that was the closest to them. I don't have details on what the uptake has been, but we certainly made them not a priority, but we made sure that they had the necessary access to get vaccinated.
Go ahead with your follow-up, Adrian.
And these organizations request now that the government put in place mobile vaccination clinics to reach out to migrants who are not able to make an appointment or go to an appointment. Is it something that the government is considering?
Well, we have a relationship with a third-party organization as well as the farms and the Department of Agriculture. So we know where the temporary foreign workers are located, and we know the farms, and we can certainly work with those farms to make sure that the workers get access to the second dose.
Next, we'll go to Tim Biscay with the Halifax Examiner.
Hi, good afternoon. Following up on that immigration question, the way I read the press release that was issued by the immigration advocates is that there's some concern that workplaces can be coercive, and there's some distrust with some of the institutions of government for immigrants that not just be temporary farm workers, but a broader range of immigrants who have various degrees of legal status. So the concern is that these people could be missed. Are you thinking about the immigrants as something beyond just those temporary foreign workers and other populations that could be reached through these this means?
Absolutely. So we're working closely with immigrant or groups that represent newcomers to the province. The Immigrant Settlement Association of Nova Scotia is one. I just mentioned we're having a specific clinic hosted at one of the mosques. Many people are of Islamic faith are newcomers to the province. So we're very aware of the need to have specific ways for newcomers to Nova Scotia to access a vaccine. As I mentioned, we have materials available in a number of languages to make it accessible to them in that way. So we're paying specific attention to not just temporary foreign workers, but to our newcomer population, and how do we make sure that they aren't left behind in all our vaccination efforts.
Go ahead with your follow-up, Tim.
Yes, tomorrow there's going to be 17,000 vaccinations. From the casual observer looking in, it's hard to make sense of what's going on. Fewer than 5,000 some days in the last 5 days average.
Tim, sorry to interrupt you, but you're breaking up. We can't hear you. Can you please repeat your question? You've broken up the whole time. Can you please repeat your question? Thank you.
I'm not sure what's going on there. Why the wide variation in numbers of vaccinations from day to day? Can you speak to that? And does that... there's worry out there that it's not getting out. We recognize that there's a large number coming out tomorrow, but the number's been very low. And so why that fluctuation?
So I don't know how many times I have to say it. Don't worry about the daily numbers. Look at the weekly numbers that we vaccinate. It's much more instructive. We have a certain, when we get allotments of vaccine on a weekly basis, that all gets broken down and distributed, and appointments are based on that. And when we get, we have several days of really high supply, and then we can only book appointments for whatever vaccine we have left before we get more vaccine. So it's much more important that people focus on the weekly amount of vaccinations that are happening and the progress over time from week to week that Nova Scotia has been making.
Next we'll go to Nabal Sna with the Herald.
Hello, good afternoon. Dr. Strang, I was wondering, we're seeing a lot of cases identified as contacts of previously reported cases. I was wondering if you have an estimate of how many people are in isolation waiting for a test or for their results.
I don't have a specific number in front of me today, but the fact that we expect that when we have cases, we identify all their contacts, the contacts go into isolation and we test them. And often they're household contacts or other times they're close contacts, so we actually expect them are to be positive. And the good news is as they're testing positive, they're already in isolation themselves. That's how the contact tracing works to break those chains of transmission.
Go ahead with your follow-up, Nabal.
Thank you. This question is for the Premier. I'm following up on, I guess, my colleague's question about incentives for getting the vaccine, but I wanted to ask you if you considered giving incentives to people for getting tested, because we're not seeing a lot of people going out and getting tested. So is that something that you've considered?
It has been talked about. We've certainly had discussions with businesses to see what they could come up with if there's something that the government can partner in. We've tried to really push testing on social media, and I go out and get tested regularly and try to encourage those to get tested. As I said, yesterday was a good day with over 4,000 tests going out, so we're going to continue to encourage that. The airport testing there now, where over 90% of people coming in are choosing to get tested. That's great. We'll continue to look at all options because there is a concern that there could be some fatigue with people that are vaccinated, so we need to all work together to make sure that we're encouraging those to get tested, and that even if you do have a vaccine, that it's very important and it's part of our success story in Nova Scotia.
Next we'll go to Paul Pickram with the Annapolis Valley Register.
Thank you very much. This question is for the Premier and or Dr. Strang. how do you respond to tourism operators who are calling on your government to include the province in the Atlantic bubble, but with a clear timeline, because they're concerned potential visitors need time to make decisions before making travel and or vacation plans?
So Prince Edward Island is June 27th. I believe the other provinces missed their New Brunswick missed their target. We're June 30th.
Go ahead with your follow-up, Paul.
But what about specifically their concern that potential visitors need time to make a vacation plans, need time to make a decision about whether they're going to visit the province? How can you help them with that?
Well, I think most people would understand that we're just starting our reopening. We're at the tail end of a third wave. If people were asking for a reopening plan, so we put together phases that showed approximate timelines, but we're in a different position. Because things have gone well since we put out that plan, we're 1 week into phase 1. That provides more and more certainty. We're getting the vaccination targets on schedule, and we're exceeding those. That provides more and more certainty. So as we get close, the first phase was really important to watch. As Dr. Strang would remind all of us, you need that 2-week period to see how you're alleviating the restrictions actually had an impact. So we're watching all those things closely. And as we get closer to the end of June, we're more and more confident to say for Atlantic Canada that you can start booking your trip on June 30th. I don't know if you have anything to add.
No, there's lots of discussions, and people are talking about the Atlantic bubble, but there really is no Atlantic bubble. We're now talking about how do we work with different regions of Atlantic Canada, and we're working to put some specific things in place as people come into Nova Scotia, as part of Phase 3 and Phase 4.
Next, we'll go to Pat Healy with the Laker.
Hello. This question's for the Premier and Dr. Strang. In New Brunswick, I understand they're doing vaccinations in schools. Has there been any thought given to doing that here in Nova Scotia?
No, we've looked at that, but the reality is we're getting good uptake in school in school-aged children who are eligible for vaccine. Very good uptake. We've got a well-established mechanisms for delivering vaccine that are working very effectively. That we don't feel that we would need to change that, and quite frankly, shifting some of our resources to schools would actually take a considerable time and effort, and would slow down our overall age-based approach. And we don't have an indication that junior and high school age youth are having any problem accessing our vaccine through our current mechanisms.
Go ahead with your follow-up, Pat.
If someone has been fully vaccinated, should they continue to get testing done? Why or why not?
So at this phase, I would say yes, regardless of your vaccination status, because the vaccine, even though your risk is much less, and it's less for 2 doses than 1 dose, there is some risk about passing on the virus. So until we're at that advice may change over time, but as we're just starting to reopen, it's really important that everybody get tested on a regular basis so we can have a handle on where we are. I said this on Monday. If there's, along with getting vaccinated, the most important thing Nova Scotians can do to help us out and be reassured that we can safely move through our reopening phases is to get tested, because that testing helps us to have the most accurate picture of virus activity in our province, which is critically important information to make decisions around reopening.
And that's all the time we have today for questions. Go ahead, Premier.
Thank you. I just want to close because this was a very difficult week for the Nova Scotia Muslim community. We've all seen the tragic news coming out of London, Ontario, where was targeted and killed because of their religion. It affects us all. But for our Muslim neighbors, the pain of such a horrific event hurts deeper. And I can't imagine how hard it is when you sit with your families to talk and reflect on such a senseless act of violence, or when you try to explain to your children something that is incomprehensible. I can't imagine your pain, but I want you to know that you're not alone, and Nova Scotia is with you. You are strong members of our province, and we are grateful that you are here. You teach us to be more understanding, more inclusive. Your presence in our province helps us grow. You make us better. Members of our Muslim community will find a way to safely honor and pray for 9-year-old Fayez, who survived this vicious attack, only to live now without his mother and father, his sister and grandmother. As our Muslim neighbors mourn, let's remind one another to be respectful and kind and to always lead with love in our hearts. Thank you.